So let's look at our second practice item. And this is another really common way that you're going to see prioritization items formatted, where we're still trying to find the highest priority, but instead of looking at the client, we're going to look at the client need or the task. So let's take a look. The nurse has been made aware of the following client situations. Which of the following client needs should receive the highest priority? So it's basically asking us, which task should we perform first? So let's look at our options. Administer an antibiotic to a client with cellulitis that was due 1 hour ago. Assess the client who reports redness and pain at an appendectomy incision site. Assign assistive personnel to stay with the client who is reporting suicidal ideations with a plan. And provide discharge education to a frustrated client who has been requesting paperwork for 2 hours. So let's take a little bit closer look, because all of these things we need to do, right? So administering an antibiotic to a client with cellulitis that was due 1 hour ago. So that right there is a routine task that does not pose any type of life-threatening risk to our client if we delay it at all. Now, if we delay that antibiotic for, days, certainly they'd be at risk for some issues such as sepsis, that type of thing. But it's just 1 hour. This patient is most likely not going to have any type of life-threatening complication if we don't administer it right now. So far, that's not looking like the best task. Option 2, assess the client who reports redness and pain at their appendectomy incision site. So whenever we have a surgical incision with redness and pain, what does that potentially indicate? It can indicate really a couple things. Sometimes just the trauma of surgery will cause some redness and pain, but it also can indicate infection. And so this is not necessarily an expected finding, but it is stable, okay? Right now, all it's saying is that there's some redness and pain, and we want to assess it, but it's not looking like the most important thing. And then you guys love option 3, and I agree with y'all. So assign assistive personnel to stay with the client reporting suicidal ideations with a plan. So we all know it's already concerning when your client is reporting suicidal ideations, but when they report they have a plan, they've typically thought about this, and there's a much higher likelihood that they'll make an attempt on their life. So that is a huge safety issue. So I think you guys are right, but let's take a quick peek at option 4. So provide discharge education to a frustrated client who's been requesting discharge paperwork for 2 hours. So I would also be frustrated if I was them and I'd been asking for paperwork for 2 hours, but ultimately that is a psychosocial need up here, which is a low priority. Now, certainly we want to use therapeutic communication, we want to address that need, but it's not posing any type of life-threatening risk. So I love option 3, and so we got it correct.